and get ready for the adventure. So we're going to talk about the IFS quiz. 3, 2, 2, and 1. Yes. So as per the ART Act, the minimum equipment required for level 1 clinics, all except microscope, centrifuge, laminar flow, and refrigerator. Be accurate and be quick. Okay, right. So 39 people have said laminar flow, which is the correct answer. 10 people have got it wrong. They say the refrigerator. Okay, can we move on to the next question, please? 3922 was the fastest. Okay, so Shivam, can we move on to the next question? The ovum donor, as per the ART law, should fit the following criteria, except she should be more than 23, she should not have donated ova in the past, she should not be more than 35, and she must be married. Quick. An ovum donor should fulfill all the criteria except. Right. So 39 people have said she should be married, which is correct. So can we know who is leading? Okay, 3922. Yes, 3922 happens to be fast and clear and accurate. Okay. So can we go on to the next quiz, please? Okay. So question 3. Under the PCPNDT Act, which form must be filled and submitted online by all those who are doing antenatal scans? Form D, E, F, and G. Easy question, right? Form F. 39 people have got it right. Great. Swapna, please don't type in the chat box. This is a quiz. You don't want to tell answers to everybody. So 5705 is the top climber. Let's see if the others can catch up. Can we have the next question, please? Right. So if there's a couple who is seeking IVF as per the ART law, they must meet the following criteria except age of the female above 21, age of the female less than 50, age of male less than 55, and she must be currently married. Soumya Ranjan, you have to add on the Kahoot app. Soumya, please log into the Kahoot app. Okay, so most have got it right. She must be currently married is not the correct answer. Can we move on, please? Okay, 75705 remains the top scorer. Okay. Consent of the husband is a must for MTP, LSCS, tubectomy, and none of the above. Can the wife undergo all these alone without asking for her husband's go ahead? 52 people have answered, 54, 55, yes. So almost all have got it correct. 40, none of the above. Can we move on? So 5705, you are really a very sharp child. You are working so fast. I'm impressed. So, which is false about gamete usage? A woman shall not be treated with oocytes from more than one donor in one cycle. A clinic is not eligible to mix semen from two males. Appropriately screened healthy women can donate her oocytes for money, and law permits using gametes from friends or family, which is incorrect. Okay, 14 people have said D also. No, this is not that. The answer is C. Appropriately screened healthy women can donate her oocytes for money. No, we cannot donate for money. It has to be altruistic. No, you can't donate for money. Sorry. Next slide, please. 5705 is really short. Others, please catch up. You got to be fast and accurate. Okay. According to MCI, for how long should the indoor non-MLC case records be maintained, preserved? Is it 3 years, 6 years, 25 years, or lifelong? Non-MLC indoor case records. almost looks like a fastest finger first, and there is no consensus amongst all the girls. 3 years is what MCI says. Can we have the next slide? Okay, now we have another top scorer, 36323. Now, others, please buck up. Okay, now this is tricky. A 16-year-old is brought by her mother for amenorrhea and is found 8 weeks pregnant. What do you do next? You refer her to a medical college because of medical legal concerns. You do an MTP unofficially without paper documentation. You ask the mother whether or not she wants a police case, or you start treatment and inform the juvenile police. So this is a 16-year-old brought by her mother who is found to be pregnant. Okay, so you all concur there. 45, yes. 45 people say that the answer is start treatment and inform the juvenile police, which is correct. I'm so proud of you girls. Let's see who did it fastest. Okay, 5705, congratulations. You have caught up again. You are up the scoreboard. Okay. The sperm or oocyte donor shall be tested for the following communicable diseases except HIV, hepatitis B and C, syphilis, and HPV. You will test a donor for all these -1. Which one is that? You've already answered. Everybody's answered. By Joe, well done. So almost all of you agree that it is HPV. Well read, girls. I'm so proud of you. Can we have the next slide? Okay. 5705. Wow. So what's wrong with this movie, Witty Donor, in view of the new ART Act? There's nothing wrong? Is it filming a sensitive topic unethical? It is illegal to hold a get-together for babies born through ART? Or gametes from one donor cannot be used for different aspiring couples? Which one is incorrect? No, which one is, yeah, what's wrong with the movie? Okay, so you all agree that one person cannot be fathering the whole city. Well done. Let's see who got it fastest. Okay, 75705. Other girls, please buck up. Be fast.
There could be guys too.
Yeah. Girls and guys, yes. Okay. So if a 17-year-old comes seeking contraception, should you prescribe always in order to prevent pregnancy? Should you assess her maturity, exclude abuse, and prescribe if appropriate? Should you inform juvenile police under POCSO? Or should you scold her and inform the parents? Okay. Okay. There's one person who wants to scold her. Oh my God. Okay. Right. Well done, girls. We are drawing to the close. No, we are midway. This is 12th question. So which ART is permissible in the state of Delhi today? Donor semen IUI, IVF ET using donor oocytes, surrogacy, and all of the above. What all are permissible legally in the state of Delhi as on date? Great. So almost all have got it correct. Well done. Girls and boys, well done. Okay. So 13th question. Which of the following is true regarding registration of an ART clinic or bank? The application should be made by the ART bank in Form 15. The registration fees for level 2 ART clinic is 5 lakhs. Registration fee for ART bank is 1 lakh. And registration fee is not refundable if the application is rejected by the appropriate authority. Which one is true? Girls and boys, you need to read up the act. The correct answer is registration fees is not refundable if the application is found rejected. Next slide, please. Eight triple C has moved up. Okay, now which of the following is not true regarding collection of or usage of gametes? Posthumous use requires prior consent of both parties. Embryos can be preserved by ART clinic for use on same recipient. all formed follicles should be retrieved from the donor, and commissioning couple should provide 6 months insurance to the oocyte donor. Which one is incorrect? Okay. So 36 people have given the correct answer. The commissioning couple has to be given 1 year of insurance. Well done, 8333. You are way up now. So in the ART law, a gynecologist means somebody who's done a PG in obs-gyne with additional qualifications except experience of more than 2 years in reproductive medicine, 3 years training in registered ART center, somebody who has performed 50 or more oocyte retrievals under supervision, and DM or fellowship in reproductive medicine. Which one is incorrect amongst these? Great. So the largest proportion knows it. The experience of more than 2 years is incorrect. The correct answer would be more than 3 years. Can we have the next slide? Well done, 6342. You are at the top now. Try and maintain your lead now. Others also, please pack up. We want to have 5 winners. So which of the following is false about embryo usage? False. Embryo of one couple cannot be used for another. During ET, a maximum of 3 embryos can be placed. Pre-implantation genetic diagnosis can be done routinely, and embryos cannot be shipped without permission from the appropriate authority. Which one is false? Great, great. We have a very learned bunch of girls and boys, isn't it, Shweta? Most of them are getting most of the answers correct. Well done.
Yes, absolutely.
So 5156. I'm so happy to see you on top. Well done. So which of the following is not an offense under ART law? Not an offense. Shifting stored embryos to another clinic without permission, abandoning children born through ART, selling, purchasing, importing human embryos or gametes, and using donor ovum in a commissioning couple with female under 25. Which one is not an offense? Well done. 41% know the correct answer. But 4 people feel that selling gametes is not an offense. No, we need to learn it there. Okay. Now 2169 has made a comeback.
Last 3 questions, right?
Yes.
4.
As per the surrogacy amendment rule, who is legally eligible as intending parent or parents? Legally married, medically ill woman of 20 and a man of 25, a gay couple 34 and 36, a widow and divorcee single woman intending to use donor semen, and none of the above. Who is legally eligible by surrogacy? Great. 36 people know the new amendment. Wow, I'm impressed. Can we move further? Okay. 74999. Wow, 3 in a row you have got correct. Back in the game. Great. So this is the penultimate question. According to the ART Act, level 2 clinic can do all except perform screening and registration of semen donors, surgical retrieval of male or female gametes, handling the oocytes outside the human body, and transferring the embryo into the reproductive system of a woman. Which one can an ART clinic not do as per the Act? Great. 46 people have answered correct. But I wonder why have 5 got it this wrong? ART level 2 clinic will be handling oocytes outside the human body there. Okay. Next, can we move further? 8 players have reached answers quickly. Wow, great. But 5705 remains in the top. So here comes the last question. Identify the correctly matched forms required under the ART Act. Form 1 is registration of ART bank. Form 2 is registration of the clinic. Form 3 is certificate of registration from the appropriate authority. And Form 5 is consent signed by the couple. Which one is correctly matched? Pretty, huh? Yeah, people seem to be different. Girls, you'll need to remember all the forms because they're important for your theory exam as well, and practically when you go into practice. So now that we are end of this, can I briefly share my screen and tell the answers to everybody so that they learn better?
Ma'am, can we have the results now?
Yeah,
Okay,
yeah.
okay. Before
Yeah.
that, we can have the results.
Yeah. So here is this podium, ma'am.
Wow. We need number 4 and number 5 also.
Can we have the other two, fourth and fifth also? Yeah, runners up.
Yeah, I'll give me everything. I want to click a picture.
So as per the ART Act,
Wait.
this is the wrong quiz.
Yeah,
open.
it is not. Shubham, it's not that we want to do the endometrium one. This is the
Yes, ma'am.
previous quiz.
I think there is a glitch, ma'am. Wait a second. Let me check.
This is the wrong one. No, this is the wrong one.
Yeah, yeah, I told. Yes. You're wrong quiz.
So you have to again log in. Everyone has to again log in.
Yes, I think.
It's asking for the PIN number again. Oh, I'm
Yes,
so
ma'am.
sorry.
I'm just sharing. Here it is, ma'am.
Yeah, the PIN is 9821824.
How many had logged in earlier?
I think 52 were there.
50
So the
plus,
moment
ma'am.
we reach 55, we will log and we will start.
Okay, ma'am.
Acha, please tell, unmute Dr. Arun Arora. He's the mentor of the quiz.
Wait a second, ma'am. Yeah, you can unmute, ma'am.
Okay.
52 now, ma'am. 52.
Have you unmuted Dr. Arun
Yes, ma'am.
Arora, sir? Yeah.
Yes, ma'am.
Yes.
We are now 54, ma'am. 53.
Yes.
I think we are
55.
good to go ahead.
So should I lock the quiz, ma'am?
GP and Kinjal, you need to enter your mobile numbers, please.
That's okay. Now, if there are two are
Okay.
there, we'll recognize them. They will send in the group if they win.
Okay.
That what's their telephone number and email. All those who, the top 5, you will send your email addresses.
Yes, we
Dr.
can log now.
Nisha, Dr. Kokila, can we start?
Yes. Go ahead.
Perfect. आप कर लो.
So correct way of measuring the endometrium thickness is, there are 3 lines and you can choose which one is the correct method and choose the correct answer. Pink line, white line, blue line, or none of the above. So the correct answer was white line. This is a scoreboard. Okay, second. So correct sequence of blastocyst implantation is, there are 4 things: adhesions, apposition, hatching, and invasion, which has been jumbled. So you have to choose the correct sequence of implantation. given the correct answer? Good. Good to go. What are the ultrasound features of intrauterine adhesions? The Asherman syndrome. Out of these 4, which are the features of Asherman syndrome? Oh, no one said the good. No one has given the answer, right answer? Recurrent implantation failure is due to most common reason. So following statements are true or false according to ASRM guideline of embryo transfer. So whether abdominal ultrasound guidance for the embryo transfer improves the pregnancy rate, and second, a delay in a catheter withdrawal after embryo placement does not lead to improve pregnancy rates. So these statements are right or wrong. You have to choose any one option. The another question is ASRM guideline recommends bed rest for how many days after embryo transfer? You have to choose the one. Iatrogenic thin endometrium may occur after following procedures like DNC, hysteroscopic procedure, placement of IUD, or all of the above. Next is the risk factor for ischemocele are following. Accept. Which one is the not risk factor for the ischemocele? Now, most sensitive and specific method to identify the ischemocele and measure the neck is X-ray pelvis, HSG, SIS, or mammography. So the correct answer is SIS. Below are the obstetric complication of thin endometrium in ART. Accept. So pregnancy induced not related with the thin endometrium. Now, patients with thin endometrium lining are known to have increased VEGF expression, decreased TNF expression, decreased VEGF expression, or increased PRP expression. What's the correct answer? Vascular endothelial growth factor expression in thin endometrium patients. Mechanism of action of cell therapy in a treatment of thin endometrium. Lots of cell therapy are used, stem cell therapy or PRP or all this cell therapy. What is the mechanism of action? The answer is following are the treatment for thin endometrium. PRP, basal layer cell therapy, vasoconstrictor, all of the above.
Dr. Kopla, we didn't give the answer to the 11th, but it's okay.
Okay, sure.
Later we'll see.
Yeah. Following pelvic procedure can increase the risk of endometritis, except following parameters measured in a Applebaum criteria of endometrial evaluation in sonography, except which is not the part of the criteria. The precise determination of the window of implantation can be done by transvaginal sonography, EMMA test, ERA, or CD138. Which test you will recommend? Treatment of chronic endometritis includes following drugs. Choose the one. fertility favorable endometrial finding on assessment by ultrasound in a mid-cycle, which will favor the fertility. Which endometrial lining will favor the fertility? The most common cause of endometrial fluid on USG in a mid-ovulatory cycle is following, except favorable serum progesterone level at trigger day for fresh embryo transfer is
Farah, you will need to make a note of all these winners.
So congratulations. This was really nice, Dr. Kokila. Dr. Arun, sir.
ma'am,
Yeah.
5 people's name.